Have you been wrestling with sciatic pain and you're really frustrated because nothing seems to be working? Please watch this video because I'm going to go over a unique take on sciatic pain that has worked for a lot of my patients, and I hope it'll help you too. All right, so what's going on with sciatic pain? Well, if you have sciatic pain, you probably have already done a little bit of research and understand that the sciatic nerve is comprised of nerve roots exiting from our pelvis as well as our lumbar spine. They braid together to form this sciatic nerve that feeds our leg. And there are points of irritation that can occur in the body that then compromise the sciatic nerve. What are those? Well, first of all, it's logical to understand that one of the obvious points is that something is happening at the spine that's comprising those nerve roots composing the sciatic nerve. The other thing is that the sciatic nerve, when it comes together, it runs either underneath or through the piriformis muscle, which is a muscle that attaches from the sacrum to the thigh bone here. And I think through 30% of the population, the sciatic nerve pierces the piriformis muscle, and the other 70% it basically runs through it, or I'm sorry, underneath it. So to further extend down the leg. So that's another source of compression. But the real question is, why would these points be compressing the sciatic nerve? And why on one side of your body rather than the other? And this gets me into talking about if you have bilateral sciatic pain down both of your legs, then typically this means that the source of the problem is coming from the spine, like a disc herniation or disc bulge, or where these nerve roots are coming out of the spine is called the foramina. You could have foraminal stenosis, where the bone is encroaching on those nerve roots on both sides of your spine. If you have a degenerated disc in your spine, the spine could be compressing on itself, which is pinching those sciatic nerve roots. So if you have bilateral sciatic pain, which means sciatic pain on both sides of your legs, it might be worthwhile to get an X-ray and MRI to see whether these conditions are happening. And cortisone shots can temporarily be used as a diagnostic feature to diagnose exactly what level of the spine these are happening. So what you would do is get a cortisone shot in a facet joint or a foramina, and if at a particular level, and if that resolves the pain, then you know that that is the level that is the problem, and then you can think about more medical solutions there. And not to say that this other information won't also help those people with bilateral sciatica, but when I, as a therapist, hear someone say that they have bilateral sciatic pain, I immediately think there might be a structural problem in the spine. Unilateral sciatica, I feel more sure that this is a biomechanical problem that we can solve. I'm going to take a break here and ask you to please subscribe, like, and share this video to help others with pain too. Thank you. So let's go into some of the biomechanical reasons sciatic pain would be happening. Right now I'm going to be talking about unilateral sciatic pain that's happening on one side of your body. It makes sense that if it's happening on one side of your body, you must be using your body differently on one side than the other. And usually this can be discovered if you simply have someone take a picture of your back and you see a crease on one side of the back that's bigger than the other. That means that you likely have something that I call a side bending problem. A side bending problem is where one side of the pelvis is higher and typically the same side rib cage is lower. And you can immediately see that if this is happening, it's going to cause more compression on those nerve roots exiting your spine and the pelvic structures too. So take that picture of yourself to see whether you have a side bending problem. And then and usually that crease will be on the same side of your sciatic pain. All right, so then the next question is, why would that crease and why would the side bending problem be happening? Well, usually it's because of an older, forgotten issue. In 70 to 80% of the cases, it's in the same side leg, all right? And then in 20 to 30% of the cases, it's coming from an older issue in your opposite leg that you're compensating for and overloading this leg as a result. In my new book, Pain Patterns, I show you a way to test not only for a side bending problem and other problems, but also to test which leg this problem is likely coming from so that you can dig down into the sources of your problem more quickly. I link the problems in the foot all the way up to the pelvis to help show you solutions that maybe other practitioners haven't looked at yet. It's a great book. If you're frustrated with chronic sciatic pain, I strongly recommend you pick it up because it will explain the body in a new way that no one has ever explained to you before, linking movement, fascia, and neurological reflex patterns that create these kinds of patterns. I have a link below, an Amazon link below this video. So we've determined that we have a side bending problem because you have a larger crease on one side. And usually what most practitioners will tell you is that, oh, well, this is happening, this pelvis is higher because you have a leg length discrepancy. Absolutely not. And then what they'll do is they'll put a lift underneath the opposite foot to bring that one up higher. Well, typically in almost all cases that I've measured leg length for people with unilateral pain, in the last 20 years, I found 4 or 5 people with actual leg length discrepancies, and those are just over a centimeter difference. So it's not that big of a difference anyway. So it's not a true leg length discrepancy, and this pelvis can look like it's 2 inches higher than the other side. But this is all due to compensation patterns, due to these old injuries that I was just talking about, and then how your brain has negotiated these old injuries so that you can still do all the things that you want. What's happened is that basically all of these compensations have caught up with you and are now creating sciatic pain. But they can be solved because they're just biomechanical problems that you are unaware of, and your practitioners likely haven't thought to look for yet. Again, all of these are listed in my pain patterns book, and all of the tests and exercises to correct these things can be found as videos on my website, and you'll just use a code that I put in the pain patterns book to get to those tests and videos, and hopefully this will solve your pain. So what is one of the causes of the asymmetry that is happening in your pelvis and spine? Well, one of the most common ones that I have found is that the thigh muscles on the front of the legs, they attach to the front of the pelvis here. And if the thigh muscles are tight, they're going to be pulling the pelvis forward like this, which creates more arching and therefore compression of the nerve roots in the spine. So this tightness can be symmetrical, in which case it would cause symmetrical compression, and therefore could be a major cause of your bilateral sciatica, or the tightness could be asymmetrical, which means that one leg is tighter than the other, which introduces a torque or rotation in the pelvis that then irritates the sciatic nerve roots. So here's a way that you can test this. So you're going to lie down on a table, you're going to bring both of your knees up to your chest, and this should feel really nice for your back or sciatic pain. Then what you're going to do is you're going to lower one leg down over the edge of the table while holding the opposite knee to your chest tightly to protect your pelvis and back. And you're going to see whether that leg can rest on the table or not. And you're going to feel how tight that thigh muscle is in the front of your leg. Then you're going to pull that back up, and you're going to test the other side too, making sure that you hold on to the opposite knee securely to your chest so that your pelvis and spine are controlled. And if you have asymmetrical thigh muscle tightness, you'll notice that one leg feels different than the other. If you solve this asymmetry, it will likely go a long way to solving the sciatic pain that you're having, either bilateral or unilateral sciatic pain. I usually hold these stretches for about 30 to 60 seconds per side and do it twice per time. And especially if you found some kind of tightness or deficit in these muscles, I would do it 2 or 3 times a day for the next 2 or 3 days and see if this resolves your sciatic pain. Of course, there are other reasons that you're having sciatic pain that may be creating this asymmetry in your pelvis. I go into all of these in my pain patterns book. I won't go into them in this video. It would just take too long to talk about all this stuff. But this should help get you going to understanding and trying a new solution or a new way of thinking about your chronic sciatic pain. Again, please share this video or subscribe and like it if you found this information helpful. And then also, if you're interested in purchasing my pain patterns book, it's available on Amazon, and I provided a link below.